My name is Patrick O'Donnell. I'm an orthopedic surgeon at University of Kentucky Markey Cancer Center, and I specialize in orthopedic oncology and reconstructive orthopedics. So I treat a lot of different types of cancers. I essentially will treat soft tissue sarcomas, bone sarcomas, bony tumors that are not cancerous tumors, and then I treat a lot of metastatic disease to bone. So the so-called bone cancer that a lot of people would call it in the public. Bone tumors are a pretty broad topic. Bone tumors can be divided up into benign bone tumors or malignant bone tumors. And then within malignant bone tumors, there are malignant bone tumors that started in the bone, which are sarcomas, or there are malignant bone tumors that started in another organ and then metastasized to the bone. So a very common tumor that we see is breast cancer that starts in the breast and then metastasizes to the bone. Lung cancer can metastasize to the bone. Kidney cancer can metastasize to the bone. So those aren't primary bone tumors. What they are cancers of some other organ that then has spread to the bone. The much more rare variant, though, are bone cancers that start in the bone, and those are called sarcomas. And sarcomas are the rarest type of human cancer. They're also one of the most aggressive types of human cancer. And so I treat both types of bone tumors, both tumors that have started outside the bone and tumors that have started inside the bone. Orthopedic oncology is kind of out-of-the-box orthopedics. There aren't a whole lot of recipes for where patients get bone cancers. And so in the same regard, the reconstruction that we offer and the resection that we do is a lot like carpentry. You have to take a problem, you have to come up with a solution, and hopefully get a patient an arm or a leg or something to walk on or use the rest of their life. And so it's carpentry in a sterile environment. The tools and tricks that I learned for reconstruction for cancer are tools and tricks that I've brought to the University of Kentucky for non-cancerous situations. Patients that have horrible periprosthetic fractures. We oftentimes can serve those patients with tumor-style prostheses that previously weren't used very much before I came to the university. A lot of the tips and tricks that I learned for pelvis and big surgeries that I learned from cancer, we take and we are helping non-cancerous patients every day with bigger reconstructive options. Patients that previously would have been told there's no good option left for your hip or your knee. We've got options now. We have options that replace entire bones. So we have replacements of an entire femur, the biggest bone in your body, that is a cancer-style prosthesis that we connect with a knee replacement and connect with a hip replacement to get patients a new leg to walk on. It's a surgery that prior to coming to the University of Kentucky was not offered here. And I have a total femoral replacement probably once every 6 months or so since I've been here, sometimes for cancer, but most of the time it's for non-cancerous indications of patients that have no other options left. They're painted into a corner with no good option for their leg or their arm, and it's been good to give those options to patients. As an orthopedic oncologist, I get to treat I get to treat patients of every age. I operate on every bone in the body. I don't have a cookie cutter surgery that I'm only good at surgery X. I get to do a lot of different surgeries, and I think it's made me a better surgeon because of it.